Hello, everyone. My name is Helen Silviger, and I'm the Manager of Patient Services at Crohn's and Colitis Canada. I'm very pleased to have the opportunity to moderate today's webinar and to learn more from our guest speakers, Cathy Evans and Rachel LePage. I'd like to start by welcoming everyone to the webinar. Today's education webinar on escaping the bathroom, taking charge of your IBD, hosted by Crohn's and Colitis Canada, is made possible through a grant from AbbVie, and it is part of the AbbVie IBD Scholarship Program. Now, before we start the presentations, some of you may be new to webinars, so I'll quickly run through how you can ask questions and how they'll be answered. Right now, all of our participants are automatically muted so that everyone can hear the speakers, and so we can capture this webinar recording without audio interference. If you would like to ask a question at any point during the webinar, simply look on the right side of your screen and you should see a field that says Questions. You can ask questions of any of the speakers by typing into the chat box. When you ask a question, even if the speaker is still talking, we will make note of your question and will present questions when the speakers have finished their presentation. So please feel free to type out your questions as you have them, and I will read as many as we have time for during the Q&A portion of our webinar after both of our speakers have presented. If we don't get to your question, please feel free to follow up with us at info@ibdscholarship.ca. Also, if you have any technical questions, you can also type this into the box and we'll follow up with you directly. If you are having trouble hearing the speaker, it may be that your computer's audio settings are having difficulties. We would recommend calling in using the number that is being provided, using either a landline or a mobile phone. And finally, this webinar will be recorded and a link to the recording will be sent to you within a week. Great, we're ready to get started. As I said, my name is Helen Silviger and I'm the Manager of Patient Services at Crohn's and Colitis Canada's National Office. Crohn's and Colitis Canada, formerly known as the Crohn's and Colitis Foundation of Canada, or CCFC for short, was established in 1974 by a group of concerned parents of children with Crohn's disease and ulcerative colitis. We are a national charity dedicated to finding treatments and cures for Crohn's and colitis and to educate people with these diseases and the public. We want the general public to be aware of these often debilitating chronic diseases and the toll it takes on the nearly 250,000 Canadians living with Crohn's and colitis. We also want people living with these diseases to be as well resourced as possible to live well with their disease. Crohn's and Colitis Canada has funded over $88 million in research to date. That makes us one of the largest funders of Crohn's and colitis research in the world. We have more than 65,000 supporters, many of whom are actively involved in our 80 volunteer groups or chapters across Canada, and many of whom have joined us today. Today's webinar is part of Crohn's and Colitis Canada's Youth Engagement and Education Programs, which includes the AbbVie IBD Scholarship, Camp Got to Go for children and teens with Crohn's and colitis, and this, our second annual youth-focused webinar series. Our education materials cover a variety of medical, social, and psychological issues related to Crohn's and colitis. We have brochures covering issues specific to children with Crohn's and colitis, ostomy care, medication, and many other topics. I will leave it at that for now, but if you would like more information about Crohn's and Colitis Canada, please visit our website at crohnsandcolitis.ca. Great, so we're ready to begin with our first speaker. I'm pleased to introduce our first guest speaker, Cathy Evans. Cathy Evans is the nurse clinician for the Division of Gastroenterology at the BC Children's Hospital in Vancouver. She is a certified gastroenterology nurse who graduated from the University of Victoria. Her career has been diverse. She started her career as an adult orthopedic unit in 1982, but found her home at the BC Children's Hospital in 1986. She started at BC Children's Hospital working on the adolescent inpatient ward and thoroughly enjoyed her teenage patients. Then, in 1990, moved to the GI outpatient clinic. She is passionate about caring for children and youth with IBD and has a special interest in the transition of youth from pediatric and adult care. Great, Cathy, over to you.
Fantastic. Great. Welcome, everyone. Thanks a lot for joining us on such a busy week. I know going back to school, getting to high school or college, it's a busy time, and I'm really pleased that you guys are joining us. The topic about taking charge is one that's really dear to my heart, because I think one of the most difficult aspects of IBD can be how unpredictable and how sometimes it can seem that the disease is taking charge of you. All the stuff that you can do to promote your health and plan for unexpected events puts you in the driver's seat. So here's to escaping the bathroom and taking charge of IBD. So some of you might be newly diagnosed. So welcome to community of folks. I've one out of 150 Canadians who, in my mind, are remarkable and resilient human beings. Understandably, finding out that you have a chronic health condition is unnerving and can cause a whole mix of reactions. People are shocked, anxious, angry, resentful. But sometimes there's relief because at least you know what's going on. You know that there can be something that can make things better. All of these feelings are normal. Oftentimes, there's another feeling, which is that of guilt, and that really shouldn't be one of these reactions. It's important to know that you are not responsible for your IBD. It's your mom or dad didn't cause it, you didn't cause it. Guilt's just a waste of energy, and it can really interfere with learning, in the words of Crohn's and Colitis Canada, to thrive and survive with IBD. So again, learning to cope. Sometimes people choose one of the strategies that are quite common is denial. But just like guilt, denial, it really takes away a lot of energy that's better directed in learning how to manage your condition. So there's certainly better strategies. In taking control, a key component of taking control is knowledge. To be successfully adapting to a new situation, you need to know more about it. You need to know where you're at so that you can navigate more efficiently and more effectively, and you can take control. So you want to learn as much as you can about your condition. Read information, check out the pamphlets from Crohn's and Colitis Canada, check out reputable websites, develop a relationship with your healthcare provider, know who to ask, who to talk to. Ask lots of questions. Attend webinars. One of my favorite learning tools for people that are newly diagnosed is about a 7-minute YouTube video that you can find on the Crohn's and Colitis Canada website. It's by a doctor from Sunnybrook Hospital in Ontario. His name is Dr. Mike Evans, and he has a really good 7-minute video that really encompasses the story of IBD, explains it in very easy to understand language and quite an entertaining format. And it's a really good show to share with your friends and family, particularly if you're trying to explain things to them. If they need to know more, it's a great way of starting that conversation. So one of the things that I've talked about was knowledge, and you need to know, what do I need to know? Well, you need to know about what your condition is. What's it called? Do you have Crohn's disease, ulcerative colitis? Did your health provider say you have undifferentiated colitis or IBD? What does that mean? Do you know what where your inflammation is, how it affects your body? You need to know about your treatments. You need to know the names and doses of all your medicines. Saying the yellow pill that I take once a day is not really taking charge. You need to know what the name of your medicines are, why they're prescribed, what you can expect while you're on them, know when you can get a response, how long is it going to take for this medicine to work. You need to know what the unwanted effects of the medicine may be. People talk a lot about side effects, and side effects are important, and sometimes they will happen, but many common over-the-counter medicines that we buy have side effects as well. They have a long list of side effects, but because we're familiar with the medicines, we never really worry about it. So do talk to your health provider. Make sure that you're effectively talking and asking questions. You need to know what your rights are as a patient. You have the right to be heard. You have the right to confidentiality. You have the right to have your answers or your questions answered. But when you come to an appointment, it's important to be prepared. One of the things that I encourage my patients to consider is keeping track of their symptoms on an app. Many of my patients are quite tech savvy, unlike their nurse, and are often quite comfortable with using things on their phones or their iPods. This is an app from Sick Kids Hospital called My IBD. It's a free app. You can download it onto a device that'll accept an app like that. But it's a good way of paying attention to your symptoms. So you can keep track of things, and when you go to your healthcare providers, you'll be able to answer questions. You'll be able to give the information that the doctor's going to want to know. When you do, you're going to provide them with information, but you'll want information back from them. You want questions answered. So write down your questions. Sometimes it's helpful to bring someone else with you. If you're a young patient, you may bring one of your parents, but sometimes if you're a university or college student, you may want to bring a friend if there's an important discussion, because sometimes we don't hear all of the things that we need to hear. If you're going to a new doctor, know what's the most important information that you want to share with them. If you're going to an emergency room, you're having some symptoms that you're concerned about, it's important to know what to say. If you go to the emergency room and say, I have stomach pain, you're likely going to be at the bottom of the list and over in the corner waiting. If you say, you know, I was recently diagnosed with Crohn's disease and I've got some involvement in my small bowel and I'm really having a lot of pain and feel kind of bloated, the attention's going to be a little bit different. If you say that you're going to the emergency room with a rash, if you just say, I've got a rash, again, go wait in the waiting room. But if you say, you know, I have Crohn's disease and I'm on Humira and I have this sort of itchy, blistery rash, you're going to get attention right away, and that's an important thing for you to know and a way of taking control. Make sure you give the information that your health providers need. So I was given a bunch of topics to choose when I was talking about taking charge, and I chose three situations that I'd like to talk about more in how to take control of some of your IBD. So I want to talk about transition from pediatric to adult care, talk about moving away to college, and also about traveling with IBD. So growing up with IBD. I'm a pediatric nurse in a hospital where we transition a large number of youth every year from pediatric to adult care. But some of you may have already made the move. Some of you may have started in the adult system. It's important, I think, it's an important rite of passage for patients that are diagnosed in the early years to be properly prepared for an adult system. Because whether you're diagnosed at 6 or at 16, when you move from pediatric to adult care, there is some differences that you need to be prepared for. Transition is really a dynamic process. It's a process that you have to evolve into and do over time. It's not simply moving from one day you see your adult or your pediatric doctor and the next day you go to see an adult doctor. It's more of a gradual taking charge and taking care of your health care on your own. So you need to learn those skills, and there's promotion of skills in communication, in decision making and self-advocacy. We try to get some of our young patients to at least spend part of their appointment with the adult doctor so they have an opportunity to practice those skills without mom and dad helping. Sometimes it's a way of starting that conversation. We want to practice building in independence and practice building on knowledge. And hopefully by 17, 18, our patients are prepared and have the knowledge that they require to really start taking charge of their health care. The difference in pediatric and adult care is certainly a different approach. In pediatrics, where I work, we're very family focused. We spend time with all members of the family. Oftentimes, we're talking to the parents rather than the individual with the IBD. It's a multidisciplinary clinic, so we have nurses, we have a dietitian, we have physicians and trainees that are all interacting with the patients. And generally, for most of our young patients, the parents are involved in most or all of the decision making. When you move to adult care, the care becomes more patient-focused. You're more individually focused. The patient is the center of the approach. Oftentimes, you're a patient and one doctor. It's not as much of a multidisciplinary team in many centers. And the patient is expected to be able to speak for themselves, to be autonomous and independent. So how do we prepare our patients? We do need to consider that there are sometimes obstacles to this because sometimes the providers, sometimes the pediatric providers, sometimes the patients, sometimes their parents are reluctant to move on to that adult transfer. Transitioning patients may be reluctant to give up a familiar atmosphere and the close relationship that they get with their providers. Sometimes youth may be not ready to transition, and sometimes we will take some more time to do some more preparation for individuals that aren't really able to take charge just yet. Parents sometimes can be overproductive, and we have to work with them to be able to learn to let go. And sometimes parents feel upset and ignored, so we have to work again with them. Adult providers may expect that the transitioning patients are going to be just like other adults in their practice, and that certainly can be a problem if the patient isn't ready. But there are benefits, absolutely, in moving to adult care. It's normal. It's a lovely rite of passage that you are taking charge and being independent of your independent with your health care. It helps to promote independence. It promotes self-reliance, and as patients move to adult care, there's a different shift in some issues that we don't deal with so much in pediatrics. Issues about pregnancy, fertility, and cancer surveillance are just a few of those. In preparation for youth to move from a pediatric center into adult care in that transition process, there are some really good resources, and in my particular facility we have a really great resource called OnTrack BC. Now I apologize, I've made an error in the website address. It's OnTrack BC, and on the last slide I do have that information. It's a really good resource for information about transition for youth, for parents, and it gives some really interesting exercises and practicing independence. One of the things that you can do is a youth quiz that tells you whether or not you have all of the things that you need to do to move from adult or from pediatric to adult care, things that you need to do to take charge. We also use a form that was developed in the Sick Kids Hospital that's called a Health Passport. If you are able to Google just Health Passport or Sick Kids Hospital, good to go. They have a really interesting way of summarizing all your health care. There's one specifically for IBD, and it's been very helpful for a lot of our youth as they move from pediatric to adult care. I'd encourage you to take a look at it. We also have something that came from my organization, and it's called Drug Cocktails. It's a website that you can freely use. It is an interesting resource that lets you see how your medications might interact with substances that you're going to encounter as you get older. So it's going to talk about how your medications interact with things like cigarettes, alcohol, marijuana, other street drugs, how they interact with common drugs that you may be getting, antibiotics or other medications. So it's a really interesting resource, and I encourage people again to look at it. So my next topic is taking IBD to college. I think that my co-presenter is going to talk a little more about this as well. But there's a few things that I'd recommend before you go off to college. I know of a number of patients who are moving across the country, and we encourage them to plan ahead. So see your doctor before you go. Make sure they know that you're going. Maybe plan to see them on school breaks. You might need a GI doctor where you go. You might need to even change your care to the place where you're going to college or university. You want to have a contact list for your medical team that are most familiar with you. Again, that Sick Kids Health Passport is a really useful thing to have. You want to make sure that you plan a reasonable class schedule. You know, if you're really not a morning person, it may not be the smartest thing to book a whole bunch of early morning classes. And the other thing I'd encourage you to do is to contact Student Health or Student Disability Office. They can be really helpful. So now you're going to be living on campus, and it's something that you may want to consider about, again, accessing Student Disability Office. They may be able to help you get a room in your dorm that's close to the bathroom, or maybe even has its own bathroom. You might need a fridge. Are you on some medicines that require refrigeration? You might need to get a small fridge for your room. What about the food? Are you on a special diet? How are you going to manage that? So those are things that you might want to consider and plan ahead for. So a little bit more about medications. Sometimes when we're busy and our schedules change, it's hard to remember how to take medications. I know that sometimes I have a hard time remembering to take my asthma puffer. So it's something that you need to figure in how you're going to work that into your life. And there are some strategies. Sometimes people use their phones using alarms. Sometimes people put their medicines where their toothbrush is. You'll need to think of some strategies. Should you always carry some medication with you? What if you're not home sometime? What if you're moving back and forth from home to school, and you might need to keep some medicines with you so you don't need to forget, or so you won't forget. Also, where are you going to refill your prescriptions? Have you had the experience of getting your prescriptions filled? Those are things to consider. So registering with disability services can be a really helpful thing. They can help with dorm assignments. They can help with getting bathroom access during exams. For people that are unfamiliar with university exams, there are some instances where you're in a very large room with a lot of people standing around the doors, and they are restricting access in and out of the exam room. But with the disability services pass, sometimes you're able to use the bathroom as you need to. Again, my co-presenter, I think, is going to talk a little bit more about this. But I would strongly encourage you, if you are considering moving away to college, or you are going to a new institution, to register, because there are some definite advantages to that. While you're away, it's important to take care of yourself. I'm sorry, I think I've just dropped a slide, but taking care of yourself includes exercise, sleep, don't smoke, learn how to reduce stress. So first, exercise. I am a large proponent of exercise. I feel that it's a really important thing in promoting health and really improves mood, reduces stress, and can be a real confidence builder. So it doesn't have to be a very vigorous, high-intensity exercise for times when people are feeling unwell. But I think that in general, exercise is a very important component in health maintenance. But recognizing that sometimes there are times when it may not be so great. I found this cartoon in looking for humor in IBD, and I thought that it was rather good that instead of calling it the John, I'm going to call my bathroom the gym. It sounds so much better that I'm going to the gym. When you're thinking about exercise, consider that it's a good strategy to think that I can rather than I can't. Think about what things you can do rather than all the things that you feel that you can't do. Try to include some activity in your everyday life. I saw a video recently that suggested that if you're feeling really unwell and don't feel like you can walk up the stairs, because that's one way of increasing activity, maybe take the elevator a floor beyond where you need to go and walk down the stairs. Try to include some activity in your daily life. Some movement's better than no movement. And then there's the 10-minute rule. If you feel like you can't really do something, you don't want to go for a walk, try for 10 minutes. What you may find is that you feel much better after you get started. But the other piece of it is, if you only get 10 minutes, you still had 10 minutes of activity. And plan some activities for days when you are having symptoms. Maybe some gentle yoga, maybe some stretching, maybe some Tai Chi, something that will help you to move and feel connected to your body. And now sleep is an important thing, and it's probably something that most of us don't get as much as we need. especially this week when you're going back to school after long summer sleep-ins, it can take some time to get back into the routine of getting up in the morning and going to bed at a reasonable time. But I think it's important to remember that really we do need more sleep than probably we're actually getting. And the minimum of sleep that people under the age of 18 require really to get an adequate amount of sleep is between 8 and 9 hours. And adults should get probably between 7 and 8 at least. Some adults need more. Sleep's essential for learning and memory, and lack of sleep can really interfere with your ability to cope with stress. So, and it can also have an adverse effect on your immune system and really your overall health. So try to figure out how you're going to get the adequate amount of sleep that you need. You're in a new environment, and not so much anymore, but young people are still smoking, and I would encourage you, if you are smoking, stop. Smoking definitely can make IBD symptoms worse. Smokers have a definite increase in disease, and if you haven't started, don't. And if you are smoking, get help to stop, and there's definitely things you can do to help. If you're in college youth health, the student health will most certainly be able to help you with that. And then finally, stress reduction. It's important for us to remember not to overcommit or overschedule. Try to find a community of friends who understand. You're on one right now, on a webinar. There are groups in your community of people with IBD who can share their experiences. Try to have friends in your dorm. Find people that you can talk to. Consider some relaxation or deep breathing techniques. I found a really cool app called Calm, CALM.com, which is a really interesting online app that you can download some exercises for free. Sometimes people find reading or listening to music to be being helpful. I strongly encourage laughing, finding something to laugh at. Google IBD and humor. You'll find some really funny things. And finally, if you're finding that you really are having difficulties, consider campus mental health. They often have very good resources for youth with a lot of stress. So finally, I'm just going to quickly talk about traveling with IBD. So there's a couple of quick things that I wanted to talk to you about. If you're traveling by air, you might want to consider pre-booking your seat, pre-ordering a special meal. Always take more medicine than you think you're going to need, because pills are going to drop under the seat somewhere. You're going to spill something, and you'll be very happy that you've got enough medicine. It's important to keep your medication in its original prescription containers, especially if you're traveling by air and going through the security checkouts. And pack your medicine in your carry-on. It would be very unfortunate to have your medication lost when your luggage gets lost, and hopefully that doesn't happen. Sometimes it's useful to have a letter regarding injectable medicines, and I know that there is a letter for those of you that would be on Humira that you can get from your health provider that you can take with you, that will allow you to take a syringe or to take your medication with you. Traveling sometimes causes us to we have unfamiliar foods or unfamiliar environments, and we can get diarrhea. So if you're worried about the quality of the water of the place that you're in, try drinking bottled water only, even when you're brushing your teeth. Try not to swallow water. Avoid ice, salads, raw vegetables, raw or uncooked meat, fish or shellfish, and peel raw fruit, because sometimes even if it's washed, you're going to get you're going to have contaminated fruit. So what happens if you do get diarrhea? Make sure you drink lots of fluids. You can boil the water. Try to stay away from ice cold or very sugary drinks, because they can make diarrhea worse. Try to take some extra salt in your diet. Consider asking your doctor before you go, is there a prescription of a medication that you might take? Sometimes people use over-the-counter antidiarrheal medicines like Pepto-Bismol, but it's probably a good idea to check with your doc before you leave to make sure that if you need them, these are safe for you to take. And certainly if you're continuing to be unwell, don't hesitate to seek local medical advice. So I traveled around the world when I was a college student, and my partner and I had a poem that we made about the toilets of all the places that we went to. And those of you that have traveled will know that toilets around the world can be quite interesting. It's often a good idea to learn the name of the word for toilet in the language of the country that you're traveling in. Know the customs. Know that some places you might have to pay, so you might want to carry small coins with you so that if you do need to use the bathroom, you can go right away and not have to search for change. You guys probably already know quite well how to source toilet facilities in public areas like hotels, restaurants, shops. There are some worldwide toilet finder apps, and I know that Crohn's and Colitis Canada are working on a Go Here card and an app that may be extremely helpful. Also, maybe carry your own toilet paper. People that I've talked to that travel a lot do that routinely. So enjoy your trip. Plan some downtime. Pack some sunscreen. You might want a written plan from your doctor before you go. And take the contact numbers of your health providers with you. So thank you very much. I just would like to remind you that you are more than your IBD. Take charge, know yourself, know what works for you and what doesn't. Don't let IBD stop you from having the life that you deserve. One of my 13-year-old patients wrote in a statement that she sent to me, if I had to choose, I wouldn't choose to have Crohn's, but since I have it, I have no intention of letting it stop me from achieving my goals. Everyone has something they have to deal with. My something's Crohn's. One day soon they'll find a cure, but until then, it's a part of me. I can't change that, but I can choose not to let it define me. So the positives that I've seen from my patients are my patients are resilient, they're determined, they're wise, they have perspective, they're empathic, they're self-aware, and they generally have a darn good sense of humor. So thank you very much. I have included some web resources that I've used for my presentation, and they should be available to you. So that's it. Thanks very much.
Great. Thank you so much, Cathy. That was a wonderful presentation. Before I introduce our next speaker, I just wanted to remind all of our listeners that if you have any questions at any time, please go to the question box that you'll see in your little control panel and write your question in, and we will have a Q&A session after Rachel's presentation. So thank you again, Cathy, and now I'd like to introduce our second speaker, Rachel LePage, who's going to share with us her personal experience living with IBD and how she lives life to the fullest. Rachel has been diagnosed with Crohn's disease for almost 2 years now and was first diagnosed during her 3rd year of nursing school. For the first time, her role switched from that of a student nurse to a patient. But with some persistence, she managed to achieve remission and has since graduated with her Bachelor of Science in Nursing. Currently, Rachel is working as a registered nurse on a surgical ward where she helps many patients with similar experiences. Rachel has a 4-year-old daughter who is starting kindergarten this year. Her daughter was only 3 when Rachel was first diagnosed, and she has not only had to learn to take care of herself when ill, but also how to balance her daughter's needs as well. Rachel has a lot of hobbies, which include kayaking, hiking, camping, skiing, painting, and reading. She's an avid volunteer within her community and believes that even with a chronic illness such as inflammatory bowel disease, it is still possible to live a rich, fulfilling life. Rachel is also one of our 2014 AbbVie IBD scholarship recipients. Thank you so much, Rachel, and over to you.
So hi, everyone. Thank you for being here today and taking the time to listen to me and Cathy and Helen. And thank you, Cathy. That was a great presentation, and I definitely feel like I've learned a lot. So I guess I shall begin. So again, I apologize. There might be a little bit of overlap between what I have to say and what Cathy covered, but you'll get a different perspective anyway, going from a clinical specialist to someone who actually has Crohn's. And then I'm having a bit of difficulty switching the slides, so I don't know if There we go. So escaping the bathroom, taking charge of your IBD. So I just wanted to include some images, so a little bit about me and my life with Crohn's disease, because I know often there are times when you have Crohn's or colitis that you may feel that life is passing you by, that you're not able to participate in the things that you wanted to participate. And I just wanted to point out these photos because every single one of these photos, with the exception of the one in the top right with my little one when I first started nursing school, all of these pictures were taken after my diagnosis with Crohn's disease. So I have some playing in the playground. I have one on a hike. I did an obstacle course with a girlfriend from nursing. The one with the flowers is in Mexico for a wedding, and also skiing in the mountain because I love skiing. So the take home of this is even when it feels really bad and when it feels like it's not going to get better, Crohn's disease and colitis is something that has periods of remission and periods of flare. So you just need to hang on in there and you get through it. And when I think back to that year when I was diagnosed and those bad times, I remember how it was to be really, really ill, but these are the times that I remember mostly when I think of those years are the good times. So you just need to keep those in your thoughts. So preparing for school. So like Helen introduced, I did get diagnosed in my third year of nursing school. One of the first things I did after I was diagnosed was go and speak to disability services, and I recommend everybody do that with any sort of chronic illness, even if you aren't currently in a flare. So what they did for me is they emailed every single one of my professors as well as my prospective professors for the next semester, and they sent them a letter just explaining that I have a condition which is relapsing in nature. So, and they set out some accommodations that disability services said that I was allowed to have. So some of those included, as Cathy mentioned, on my final exams. They're usually in a big gymnasium, so they're 3 hours long, and you're usually not allowed to leave. So during those finals exams, I was allowed to leave and use the washroom if I need to and come back, and they didn't count that time away from my test. So if I did have to go and leave the washroom, they would stop the clock and I could come back and I could have that additional time to finish my exam. They allowed me to take water bottles in because I know a lot of times when you have a chronic illness, it's hard to stay hydrated, especially if you maybe have some diarrhea or things like that. They let me take snacks. We had a condition where I was allowed to be late, you know, as long as you actually have an excuse, because you can't always tell how your mornings are going to be, or your afternoons things may come up. So then it was just required that I come and I sit quietly in the background. So we did manage to get through the semester, and I had a really, really good experience with disability services. Open communication. I hugely recommend open communication with professors. They have heard of these things before. You're probably not the first person that they've met. Open communication allows them to understand what you are going through, and therefore they're probably a lot more understanding with your condition. They'd probably check in with you, ask how you're doing, make sure things are going okay, and that can be really good because most students are really good, but some of them may abuse the system a little bit. So it's nice for the professor to know that what you're doing is legitimate, you have good reasons to be late, and that way they won't hassle or heckle you. They'll actually be a supportive player in your school. And also have a plan to see your GI as regularly as needed, especially if you are currently going through a flare. You may be feeling okay right now, but your next appointment isn't for a couple months. It's totally appropriate to ask your GI, hey, like, I'm a little bit worried about how things are going. Can I see you in a couple of weeks so we can just make sure everything is going okay? And usually GIs are really good if you're nervous on scheduling you more regularly than they usually would. And that way you're confident, you feel good, and if something does happen, you do have that appointment as a safety net. Oops, I think I skipped one. I don't know if we can go back. Okay, so preparing to live abroad. One of the biggest things is be pharmaceutically prepared. Usually, I think a lot of people would recommend taking enough meds with you to last your entire trip, as well as a couple extra, because you don't always know where you can go and get refills. If that isn't possible and you need to get refills, then often you can contact, I know if you're living abroad for a semester, you can usually contact the university and they can give you some more information on where there may be a pharmacy that you can do that with. If you're taking meds with you that need to be chilled, you can often call the airport ahead of time and arrange for it to be chilled in the fridge. Another thing is over-counter meds may not be available, so it's often a good idea to stock up and bring your own. Things like Gravel. I remember my sister went on a study abroad trip to Vietnam, and she ended up getting a cut on her leg, and she went to the pharmacy to go get polysporin, but they'd never heard what polysporin was. So another thing I would advise is to know the active ingredients in your over-the-counter medication, because although they didn't know polysporin, they recognized that there was Bactrim in that, so she was able to get the active ingredient for her wound. So talking to your school about IBD, I actually had a really, really good experience going to university and communicating with disability services as well as professors. I find the more open I am about my IBD, the more people I meet who also have IBD or have a cousin with IBD or a sister or a niece. So there's a lot more people out there than you would think. You don't have to tell anyone about your IBD if you don't wish to. But like I said, if you do communicate about your condition, there's a lot more support that could be available that wouldn't be available just because people don't know that you need it. So if you are to talk about your school, I would talk about bathroom needs, the need to leave class in the middle of it and then come back. That may have to happen a couple times depending on where you are in your flare and what your symptoms are. I think we spoke a little bit about being late because you just can't tell. It's unpredictable what things may happen. Nutritional needs like snacks, absences, and whether or not you need doctor's notes. Most of them are pretty good with not requiring doctor notes after your initial one. Exam accommodations, so that's things like extra time leaving exams, as well as privacy and confidentiality. So anything you tell disability services is private and confidential, and the letters they send out to preppers don't usually say what specific condition that you have. You are allowed to inform your teachers of that specific condition if you wish, but you don't have to. So talking to an employer about IBD, I know this one might be a little bit more difficult than talking to school. So I guess first off is you don't need to disclose your IBD during an interview, and employers are not allowed to ask or discriminate when they are interviewing you, but I would recommend making sure that you are fit to practice that job. So I wouldn't go and apply for a job in the middle of a flare. You may need to talk to disability to see if you need income, and there's other ways to get around that until you are better and can practice. I know as a nurse, I have met a couple of other nurses one other nurse, and she had her license removed several times when she was really ill, so she ended up just going on income assistance at that time, and when she was feeling better, she got her license back, just because you do need to be fit, because if you're not feeling well and something happens at the job that's not safe for you, for me, it's not safe for my patients, so just be really honest with yourself. And there are some advantages to letting your employer know what's going on. You and your employer can work together to identify your needs and make accommodations. And if fellow staff know what's going on, they're more likely to give you the support and assistance you need. One big thing I think to remember is that employers and staff members are people too, and they might even know somebody with IBD. If they don't, and this is the first time, empathy and support is a normal human emotion, so it's pretty good to work with other people and build a social network. And I think that's about it. So if anyone, for my part anyway, so if anyone has any questions for me on working with IBD or being a parent with IBD or going to school, I would love to answer them. Thank you.
Great, thank you so much, Rachel. That was really, really informative. So great. Before we get to the question and answer period, I just wanted to remind everyone about our other upcoming youth webinars. The second one that we'll be hosting is on Thursday, September the 24th at the same time, 7 p.m. Eastern Standard Time. And it will be on the topic of getting through it, choosing your path to good health. You'll hear from experts on what you need to know when you're experiencing a flare and the different treatment options to help get you in remission and back to school. And then finally, our third youth webinar will take place on Tuesday, October 6th. And the topic that day will be tests, and more tests, surviving school, and the doctor's office. Our expert speakers will explore the different medical tests that patients with Crohn's and colitis may experience and ways to balance these tests with your schoolwork and your school load. Please go to crohnsandcolitis.ca/webinar for details and to register. And if you can't make those dates, don't worry. You can always register for the webinar, and we'll make sure to personally email you a link to a video recording about a week after the webinar takes place. Great. So now on to the Q&A. We'll go ahead and unmute Cathy and Rachel, and I'll open the floor to questions. So the first question we had was, for either of you, you could answer this. Maybe even both of you'd like to answer this. But we had one of our participants ask, how do people cope if they have an accident?
Great question. Rachel.
So that is the reality of the situation. I think that I did write that down on one of my slides that I skipped over. A good strategy, if you feel something coming, try to get out of the room to use the washroom. If that doesn't happen, then it's always good to maybe carry around some extra clothes with you. If you're a woman, it's easy to just slip a pair of pants and some underwear in your purse. If you're a man, you may want to carry around a backpack. I think I also mentioned keeping some things like you might want to keep some baby wipes in your purse as well, and a Ziploc bag, and then you can take anything that's soiled and put it in the Ziploc bag and close it up and continue on with life. And again, this is also one of the good things about if you had communication with your teachers and if you had communication with your employers and your staff, they kind of understand what's going on a little bit better. So you may feel a little better about the situation if people are a little bit more understanding.
Absolutely.
Great. Thank you, Rachel. How do you deal with the anxiety related to finding a bathroom? Do you have any other strategies?
Planning ahead can relieve a lot of that anxiety. I know friends who go for walks and they go for exercise, and they actually have planned their walk and their route, and when they travel and they know where the local washrooms are. So it's always a good idea to plan ahead, and then that way a lot of that anxiety is relieved. If it's not possible to plan ahead, it's if you are traveling, like Cathy said, it's good to know the native word for washroom or bathroom, things like that. And you always keep an eye out to make sure you have an idea of where something is, and then taking extra clothes if you can't find one, right?
Yeah.
Cathy, did you have anything to add?
I think she did it beautifully. I don't really have much else to add, Rachel. I think that's
excited for those Go Here cards.
Yeah.
Yeah, well, I'll actually do a plug for that. We have launched our mobile app. If you go to gohere.ca, it's go-here.ca, or you can find it on the Crohn's and Colitis Canada website. You can actually download the app for iPhone and for Android, and I believe it's available for BlackBerry as well. And so that app, it currently shows all of the washrooms that are accessible in Canada. And the great thing is you can add washrooms of your own. So if you have some favorite go-to washrooms, you can add them to the app as well, and then that helps out other users.
Oh, that's great.
And actually one of the features of the Go Here app for your mobile phone is that it actually has your Go Here card. It's right there within the mobile app. So if you're having trouble accessing a washroom, and you can just flash them the card on your phone, and they should allow you access to the washroom. And the other great feature of the app is we've partnered with a number of different small businesses that have made their businesses Crohn's and colitis friendly, and so they have a decal on the front of their store window saying that they're Crohn's and colitis friendly, and you can come in and use the washroom, no questions asked, and no requirement to purchase anything from them. And those washrooms are also added to the mobile app as well.
Yay!
That's great.
So hopefully finding a bathroom will become a little bit easier. Great. So Cathy, I now have a question for you. We had one of our listeners is planning to move away for school, and they might be moving out of province, and they're wondering what's the best way to go about finding a medical professional in their new province?
Such a good question. the community of GI professionals in Canada is actually a relatively small one, and generally providers or GI doctors in one province have an association or know of other doctors in other areas. So that might be your first way of accessing care in whatever province you're going to be going to school in. I know that I have some sort of joint care patients who live in British Columbia but go to school in Ontario, and they have a doctor in Ontario and a doctor in British Columbia. I think it just has to be clear, if you're traveling back and forth, who's going to be the most responsible physician, who's going to be the one that makes the decisions, and that you can certainly broach that with either physician, so that it's a clear understanding that who's going to be making the main decisions around treatment.
Great, thank you, Cathy. I now have a question for Rachel. One of our listeners wanted to know if you missed a lot of class time due to your Crohn's disease, and if so, how were you able to make up that time, or how did you handle that with your school?
I did this a fair bit when I was first diagnosed. I actually ended up in the hospital for a little bit there, so I was lucky. I had some good friends who would they emailed me PowerPoint slides. I would ask things for that. I stayed in touch with my teachers, and I got quite a few extensions on many assignments, and my teachers were all really supportive of that. Some of the due dates I kind of got, and when you can hand it in, please hand it in, and that was super helpful for papers. So I think, again, it depends on, like, if you're going to miss the whole semester, that's a different story. But for me, I missed about 2 or 3 weeks all at once, and then a little bit, like one day here and one day there. So I was able to take those notes and study at home, and then take my assignments and my papers and work at them at home and hand them in on different dates, and that was really well for me.
Great, thank you, Rachel. We had a question from one of our listeners about what are the most common trigger foods. I don't know, Cathy, if you wanted to briefly mention what from your experience.
Yikes.
Rachel? Pretty common question that we get here at Crohn's colitis.
It certainly is. It's a common question that we get as well. It seems that, honestly, they're pretty individual. I think that a lot of times people are really hopeful there'll be sort of a prescription that they can have that will say, stay away from these foods and everything will be fine. For individuals that have small bowel Crohn's disease that might have problems with obstruction, foods that don't completely break down can be a problem. So things like foods that have lots of little seeds, like pints and pints of blueberries or strawberries or nuts or popcorn is a common problem kind of trigger food. But honestly, to say which is going to be a trigger for a flare of IBD in any other circumstances is pretty individual in my experience. Have you got any words, Rachel?
I would have to say, I know that's definitely not what I wanted to hear when I was looking for that information, but it is pretty individual. Popcorn is awful. That's one thing, and I'm in remission right now, so I'm doing pretty good, but I still stay away from popcorn because that definitely is a bad one.
Okay, great. I have another question. One of our listeners wants to know, how do they tell their friends about their IBD? How do they go about telling them and making them understand? And this person also had sort of a second question related to that. How do they make their family understand that it's not necessarily that they're making it up or that their diet is causing the flare-ups? Kind of a two-pronged question.
So I guess I was pretty lucky that most of my friends were nurses because I was in nursing school, but I know a lot of people in my life who had never even heard of Crohn's disease before. So one of the something I guess I would recommend is the more educated you are on what's going on with your body, the more words you'll have to explain it to other people. And Cathy pointed out that really good video. I've actually watched that Crohn's and Colitis has on their website with Dr. Mike. You can always show people YouTube videos, you can give pamphlets. Crohn's and Colitis Canada has a lot of information to give people. I know one of the hardest things for me when I was sick is often people with Crohn's and colitis become very anemic, and that makes you very, very tired. And that was one of the harder symptoms for me to try to explain to people, because everyone can see if you're throwing up or if you're feverish or things like that, but it's a lot harder to see that illness and being really tired. So that's where having those resources and having that knowledge comes in really handy for me. Cathy?
Yes, I agree. I 100% agree. I think that the invisible disorder is the hardest to manage, because you're right, you look completely normal. Like, what are you talking about? You're tired. I think it is, but I strongly endorse what you said about knowing yourself and your body well, and understanding your illness, because you do have the confidence then to be able to share that with the people in your life. And if you clearly understand it, then it's presented more effectively. And I think that one of the things that I often talk to people about is that ultimately IBD is really more of an immune disease than it is about a dietary disease. And that's a hard concept for a lot of people to get, because you assume that whatever comes in your mouth has such a great deal to do with the illness, and really it's more of an immune modulated problem than a dietary problem. So it's an immune disease rather than a nutrition disease.
And you can always, for family members, if you're comfortable with it, you could always take a family member with you on a checkup or something like that. And then the nurse or the doctor might be able to explain to them as well if they're insistent on maybe talking to someone else.
Absolutely.
Yeah, a couple of strategies.
Thank you so much. We have time for one last question, and this could be for either of you to answer. So the question was, how can I what are some of the ways that I could get involved with the IBD community?
Okay, so
Rachel.
Yeah, I'm actually the treasurer of Crohn's and Colitis, my chapter locally where I live. So I got involved by going to the Crohn's and Colitis Canada website, and there actually is a tab. I can't remember what it says, but it might even say how can I get involved or volunteers or something. And you fill out a form, and they will submit that to the local chapter closest to you, and then they contact you usually within 1 or 2 days, because we're all very, very keen for volunteers. And you start going to meetings, and the nice part is it's not a huge time commitment. It's really, the time commitment is as much as you want it to be. So if you're busy during school or exams, you can take on less, and if you are in the summer or you're really keen to help, there's so many activities throughout the year that you can do. I've been involved with galas and gutsy walk and barbecues and a golf tournament. When I volunteered for the golf tournament, I took my 4-year-old with me, and we stood out on the green and laughed and volunteered all day. It was lots of fun. So there's definitely lots of ways to get involved, which I would totally recommend. So.
I 100% agree. I found that a lot of my kids got really involved in the Gutsy Walk and found that was really empowering for them. But they also met other kids and other families, and it was in a really fun environment. And so I strongly endorse that.
Great. Well,
so yay to whoever asked that. Good for you.
Great. Well, thank you so much, Cathy and Rachel. Unfortunately, we can't get to all of the great questions that were asked, but to those of you who asked the question, we'll do our best to respond to you directly. So as we're drawing near to the end, I'd like to take this opportunity to let everyone know that we will be following up with you after the webinar via email to get your feedback and any suggestions you have for future topics. We're always interested in hearing from you, so please make sure you participate in that. Also, we'll be sending you a link to the recording of this webinar, so you'll be able to watch this over, and if there's anything you missed or any of the slides you wanted to look at, you can do that. So this concludes today's webinar. I want to thank everyone for being with us today and for the great questions, and I especially want to thank our speakers, Cathy and Rachel, for taking time out from their really busy schedules and for sharing their expertise and their experience with all of us. Also, thank you so much to AbbVie for supporting this webinar. And thank you again for joining us. I hope we've helped answer some of your questions about living well with Crohn's and colitis. Have a wonderful evening, everyone.
Thank you. Bye, everyone.
Bye.
Bye.